to take a look at just what kinds of responsibilities can be delegated to employees and to trainees, and in fact to students in training, and which cannot. Generally, under the uh, Psychology Board regulations 64B19, um, professional responsibilities include clinical diagnostic interviews, providing therapeutic or treatment services, administration and scoring of tests by properly trained and supervised staff. Once again, notice the emphasis on properly trained and supervised. Now, this, of course, includes, and this is the next part of it, psychological trainees, practicum students, interns enrolled in APA-approved doctoral programs who are using that training to fulfill requirements for a doctoral degree. It also includes psychological residents, that is more advanced students practicing in accordance with 64B19, or those working in a state licensed facility. The state has certain provisions for what supervision must involve. Now, what is involved in supervision is, first, the supervising psychologist must be, and the words are, quote, reasonably available, unquote, whenever the assistant is performing the delegated duties. Now, it would be very simple if we said, well, that means that the supervisor has to be on site at all times, and in fact, in some cases, it is. But there are certain circumstances where that is not possible. For instance, in a university training program where we have interns at a number of different training sites, sometimes it becomes impractical to have the supervisors, who are also faculty members and have to be teaching courses, physically on site at all of these different training facilities. So generally, reasonably available has been interpreted to mean either physically present or able to be reached. So very often in our training program, we are in fact reached by students who encounter some sort of clinical difficulty or emergency or question that they need some sort of input on. The faculty members, what are called intensive supervisors, are available essentially anytime by cell phone and will return a call generally within the hour. So, for instance, if a student encounters a situation in a particular off-campus site that involves the question of whether or not some particular abuse needs to be reported, and if so, to whom, the supervisor will inevitably be contacted and asked for opinion and direction on that. So reasonably available. While it would be nice if we had enough psychologists all over the place to be on site, this is sometimes impractical. So either on site or able to be immediately contacted. It has to be pointed out that whether or not the supervisor is on site or not, they are responsible for all delegated acts. Now, this is a very important feature because it means that the psychologist, the supervisory psychologist, has to know at all times what is going on in that particular trainee or supervisee's caseload. The idea that the psychologist did not know, the supervising psychologist did not know about that particular client or patient, or that the supervisee has not discussed it in supervision is no longer an excuse. A particularly extreme example was noted in a case in the state of Illinois. And in this case, a supervisor was seeing an individual in supervision who was trying to gain enough hours to be independently licensed. The supervisee brought in and talked to the supervisor about 4 patients that he was seeing in psychotherapy. As far as the supervisor knew, that was the supervisee's entire caseload. What the supervisee did not tell the supervisor was that there was a 5th patient whom in fact the trainee was having sexual relationships with. When the woman involved eventually filed an ethics complaint, the supervisor's defense was that he in fact did not even know about it. It actually was not an ethics case, it was a malpractice case. And the court essentially ruled that the supervisor should have known about it. That is, the reasoning was you should have a close enough, intimate enough, and careful enough relationship with your supervisee that you basically know that everything that is going on. A lot of people see this as unfair, and in fact, this does seem to be an atypical case. It hardly looks like this will be determined to be a standard of care for supervisors. Nevertheless, it is a warning bell for us that the kind of cavalier attitude towards supervision that a lot of supervisors have, where they merely sign off on a supervisee's work and are not very carefully involved in the actual training, the actual supervision on a case-by-case basis, that is becoming a somewhat risky practice. We really have to be responsible for all acts which we delegate to our supervisees. We also have to be available for emergency consultation and direction of the assistant. An assistant, of course, can mean an employee, a trainee, a supervisee, and for the patient intervention and management. Once again, it goes back to the issue of being reasonably available for such intervention. The assistant cannot hold her or himself out to the public as independently providing psychological services. I refer back to the case I mentioned a few moments ago, where a particular psychologist who was in fact under the supervision of a licensed psychologist had on her letterhead her name, a PhD, and her office address. Did not say licensed psychologist, it did not say psychologist in training, it did not list the name of the supervisor, and in fact this was a misrepresentation by omission. She in fact managed to get herself, as I said before, on the list of individuals who received court-appointed custody cases. In this particular case, one of the parties in the custody evaluation became very dissatisfied with the results and filed an a complaint, an ethics complaint, with the state licensure board against this psychologist. It turned out, when the board took a look at the case, that they found out for the first time that this was not a licensed psychologist. So they looked for whom the licensed psychologist was, found his name, and in fact found that his supervision of this individual was exceedingly limited, even though she continued to hold herself out to the public as a PhD psychologist providing professional services. He saw her perhaps once or twice a year and would, in very broad terms, discuss her cases, but really had no first-hand knowledge of any of these cases. Now, as of January 1st of 2012, the board would be establishing training and supervision verification process. I put that with a question mark because this is something that is in process, and actually the training and supervision verification process has not yet been finalized. Another thing that is important when we are talking about the people being supervised and avoiding this matter of having many people under your supervision is that you can only have a maximum of 5 people operating under your license. This once again is to make sure that the supervision is adequate and that you do not take on too many supervisees to provide good and adequate training for them. Now, the annotated code talks about that the number of hours of supervision will be at the supervisor's discretion, and that the actual board regulations talk about a minimum of 2 hours of clinical supervision. So that, of course, is an example of the board interpreting the general statute to refer to what discretion may mean. So it has to be a minimum of 2, but of course it can be more than that. Now, a very important part of this I hinted at before, but it bears repetition, that before delegating duties to a psychological assistant, you might say, read this as trainee or supervisee, the supervising psychologist must first complete a diagnostic interview or review existing diagnostic records of the service recipient, that is, the patient or the client, in order to determine the appropriateness of such delegation. This is now a regulation of the board, that as a supervisor you actually have to know, by actually interviewing or at the very least reviewing the records of the service recipient, otherwise known as client or patient, that the supervisee or trainee is seeing. So you cannot have the excuse, well, I didn't know that they were seeing that particular client or patient. And the important last sentence there, or last phrase, in order to determine the appropriateness of such delegation. What that means is that the supervisor is held responsible for the, you might say, the goodness of fit, or the match of that particular client or patient with that particular trainee or supervisee. You have to have some sort of documentation of the fact that you have evaluated the case, again, either by seeing the individual or by reviewing the record, and have determined that this is the appropriate individual to be seeing them, that this individual has the competence and the skills to see this person and to treat them appropriately. The supervisee or assistant may gather history, behavioral data, administer and score tests designated by the supervisor, do cognitive skill training, behavioral programs, biofeedback training, relaxation training. These are all examples. But this is the important phrase, but not make independent clinical judgments or inferences. So essentially, when clinical judgments or inferences, namely diagnoses, these have to be countersigned by a supervisor, and the supervisor has to have some sort of documentation of the fact that they have reviewed the material and that they believe that this is an appropriate diagnosis or judgment. Once again, you need to clarify the supervision, clarify the circumstances under which the supervision is given, and how it is given.